Hello there, this is Dr. Mintz. This is a 44-year-old male who came in with a headache and fever. Let's look through the soft tissue images of the CT head. We obviously see an abnormality. How will we describe it? Very important. Well, it's a low attenuation abnormality, and it is located in the temporal lobe. You can tell it's a temporal lobe because this little fold is the Sylvian fissure, and we have to go up more superiorly to follow that Sylvian fissure posteriorly. And here's a little bit of the Sylvian fissure here, and here you can see the folds of cortex in the region of the Sylvian fissure. And then we get above that level here. So this is below the level of the Sylvian fissure in the temporal lobe. It's a temporal lobe because it's inferior to the Sylvian fissure. It's in the region of the left temporal bone. This is the temporal squamosa. And the petrous portion of the temporal bone is this tent-like structure here, which we see on both sides. Okay, so what could this be? It could be any of a number of things. It could be a tumor. It could be cerebritis. It could be an abscess that we're not seeing the details of because there's no IV contrast. So, moving along, let's look at the bone windows and study the temporal bones a little more clearly. These are the mastoid air cells on the right. Here they are on the left. They are smaller, they are opacified with soft tissue attenuation, and this is probably a relatively long-standing process since usually the mastoids are relatively symmetric. So these are not only opacified, but the bone around the mastoid air cells is sclerotic, and that's what has caused these to become a little smaller and for the bone itself to look quite different than it does on the right. Okay, so those are the mastoid air cells, and that would suggest mastoiditis. And the fact that there are signs of chronicity on this side suggests it's chronic mastoiditis. Here you can see the external auditory canal that goes to the ear on both sides. And you can see also on this side, for example, that the mastoid air cells communicate with the middle ear cavity, and it is in the middle ear cavity that we have these ossicles, and this is sometimes referred to as an ice cream cone appearance. You have head of the malleus and the body of the incus forming those two constituents that give the appearance of an ice cream cone. You kind of see it over here too. Here you have air surrounding the middle ear ossicles. Here you do not. Now let's not forget what we saw on the head CT. Remember, we saw a low attenuation area right in this region here. And we can kind of see it here, but again it's without contrast. So let's look at an MRI, and it's contrast enhanced, and lo and behold, we have a small ring enhancing lesion, probably about 1.5 centimeters maximum diameter, with central low signal, very suspicious for an abscess. Now, a tumor of some sort, a neoplasm, could easily look like this as well. But the fact that we have pre-existing, long-standing mastoid air cell disease leads us to believe that this is an infectious process, and that what has happened is the infection in the mastoid air cells has eroded through the bone and caused an infection in the temporal lobe itself, and that temporal lobe now has an abscess in it, along with surrounding edema. Now let's look through some fine bone detail here, and again we see nicely the sclerotic mastoid air cells. You see soft tissue attenuation within them, and you have these well-aerated mastoid air cells on the other side. Now as we come up, here you see the jugular canal, where the internal jugular passes. And as we follow it more superiorly, we see differences in other areas. So for example, here we have the middle ear cavity, and here we see some soft tissue along with the middle ear ossicles, whereas on this side we do not see that. Here we have, let's see if I can get that a little clearer. Here you have the cochlea on the right side, the normal side, and here it is on the left, pretty much intact on both sides, I'd say. And then you have the vestibular apparatus, which are three little rings, 1, 2, and then 3, to each have a different orientation, and the three of them combined represent the three spatial dimensions of our physical world. Here you have the internal auditory canal. So, again, you have the cochlea and the vestibular apparatus. The ossicles of the middle ear are activated by vibrations from the tympanic membrane, and these in turn transmit them to the cochlea, and the cochlea in turn transmits them to the eighth nerve, which goes in the internal auditory canal here. And the same thing is going on, of course, on this other side. So here you see the cochlea on the other side, a little difference in the tilt from one side to another. So that's the cochlea, and vestibular apparatus are right here. On this side they're here, and again they are in three planes, 1, 2, and 3 would be kind of like this. 3 different planes representing the 3 spatial dimensions. And similar structure to the cochlea, except the cochlea is like a snail shell, and the vestibular apparatus also contributes nerves that go to the 8th nerve, and the 8th nerve is called the vestibulocochlear nerve, the vestibulocochlear nerve, and it gets input from both the cochlea and the vestibular apparatus, and they go immediately into the brain stem as the 8th nerve. Okay, so why have we gotten an abscess in this case? Well, if we look closely, we'll see that here are the ossicles, and here is the opacified middle ear cavity. And on the right it's aerated and there's bone overlying it. On the left it is filled with soft tissue, inflammatory tissue, and there is no bone over it. There's a gap in the bone that ordinarily covers the ossicles and the middle ear cavity and separates it from the cranial vault. So here you have a wide open defect in the wall of the middle ear cavity that allows communication to that part of the temporal lobe there. And if you hold that in mind right there, you'll see that that's just about where the abscess has occurred in the temporal lobe. Okay, and here you have a nice view of the jugular veins themselves on MRI. and you have the internal carotid arteries on both sides, and if you follow those up, you see them course anteromedially, and then they enter the cavernous sinuses on both sides, and then they emanate from the superior aspect of the cavernous sinuses and give rise to the middle cerebral artery on each side. Here you see the left middle cerebral. This would be the left M1 segment, and here you have kind of a branched M1 segment on the right, and you can see also the A1 segment of the anterior cerebral artery on the left and a hint of it on the right there, and here it is, the A1 segment of the right anterior cerebral artery. They would be joined by a very small vessel, the anterior communicating artery. Okay, that's it for now.